Hello, my name is Jennifer Constantine, and I am a senior majoring in Speech and Hearing Sciences at Lamar University in Beaumont, Texas. My research is entitled Preschool Teachers' Perceptions and Knowledge of Speech-Language Pathology. I will now proceed and thoroughly explain my study's background information, procedures, results, and overall clinical implications. Literature shows that preschool teachers are critical in helping identify children who may require speech and language services. Preschool teachers are among one of the professionals that will spend many hours with children, and it is important that they can identify children's developmental milestones and symptoms of speech and language disorders, because this knowledge can be the factor that enables a child to receive the early intervention they need for better outcomes. Therefore, this study was created to examine preschool teachers' perceptions and knowledge of speech-language pathology, as well as in an effort to increase these preschool teachers' knowledge about what speech and language is, disorders associated with speech and language, the roles of speech-language pathologists, and milestones of preschool children. 3 research questions guided my study. The first one was to determine if there were any differences in the knowledge of preschool teachers before the presentation was given based on what preschool setting they were employed on, whether that was a public or a private preschool. Second, I questioned if there was an increase or a decrease in the teacher's knowledge from pre-test to post-test based on the preschool setting they were in, again, whether that was a private or a public preschool. The third question was to determine any difference in the preschool teacher's knowledge after a 2-hour presentation. For this study, I recruited 38 preschool teachers. 13 of those were from a private preschool and 25 from a public preschool. These teachers ranged in age, level of education, and experience as a preschool teacher. To begin the workshop, I passed out a demographic questionnaire that gathered the participants' basic information such as age, gender, race and ethnicity, education, and years of experience. After the demographic questionnaire was given, a Likert type 28-item survey was passed out, followed by a presentation that informed the teachers of common misperceptions of speech-language pathologists, definitions of speech and speech disorders, definitions of language and language disorders, developmental milestones, facilitative techniques during play, facilitative techniques during book reading, signs and symptoms of speech-language disorders, and additional resources if they suspected a speech or a language delay in their children. Once the presentation was complete, a second survey was administered, identical to the first Likert type 28-item survey. After analyzing the results, it was reflected that there was no difference in knowledge among the teachers based on whether they were coming from a public or a private preschool, meaning that all teachers had a similar amount of knowledge before the presentation. Moreover, there was also no difference in the teachers' knowledge from pre-test to post-test based on the setting, meaning that one child care setting did not benefit more than the other from the presentation. And lastly, after combining both groups, the results showed that the 2-hour presentation had increased the teacher's knowledge from pre-test to post-test. Here are some survey questions that had insignificant results when compared between pre-test and post-test. I would have wanted many of these to be significantly different because most of these questions are considered developmental milestones, thus important for teachers to know. For example, teachers should have disagreed with this statement that states that a 2-year-old should be using about 50 words because a 2-year-old should be at least at 200 words in their vocabulary. Though, of course, maybe an extensive presentation on developmental milestones would benefit the teacher's knowledge more. Down here are questions that had a significant difference. As we can see, the preschool teachers felt more comfortable identifying a child with a speech or a language disorder and referring a parent to a speech-language pathologist. They also learned that speech-language pathologists not only work with school-aged children, but individuals of all ages, and also that a child should say their first word around their 1-year birthday. Overall, this study aimed to find what perceptions and knowledge preschool teachers had of speech-language pathologists and speech-language pathology, and target that with a 2-hour presentation to increase their knowledge. Again, no significant differences were found in a teacher's knowledge based on childcare setting nor in their knowledge across time from pre-test to post-test based on the childcare setting, thus concluding that this presentation had the potential to increase the teacher's knowledge and comfort in helping identify children who may need therapy. Lastly, because early intervention is important, it is crucial that we increase preschool teachers' knowledge of speech-language pathology, because then these preschool teachers can refer the child and parents to the appropriate professional as soon as possible, thus increasing the likelihood that the child will get therapy sooner and decrease the chances of the child falling behind in academics or the disorder worsening. Thank you for taking the time to watch this presentation, and I hope that this video well illustrated my research study.